Advocating about workforce shortage is something that I may be expected to engage in. For example, when there is not enough staff to meet the needs of a patient who is an extremely high falls risk with aggression and or confusion may require that extra support. And so, of course, the first line interventions will have to be bed alarms and bed rails, as well as frequent rounding to check on the patient. And for agitated or aggressive patients, drug therapy may also be an intervention. However, when that is not enough, advocating for an extra staff member to be put on as a one-to-one special may be required. Now, of course, there is costs associated with putting on an extra staff member, so to really strongly advocate for the patient's safety and well-being will be necessary. And so for the outcome we'll be looking for from this advocacy will be for a decreased number of falls or no falls, and so for that long-term health of the patient to improve, for the patient to not deteriorate, and for them to be eventually discharged. And another type of advocacy that I may be required to engage in is environmental advocacy, for example, televisions in hospital patient rooms. Now, of course, this can be brushed off by saying this is a hospital, not a hotel. However, for patients, especially elderly patients who don't have electronic personal devices or have difficulty using the internet as such, the television will be a way for them to keep connected to the outside world and also as a form of entertainment. And so to strongly advocate for that vulnerable population so they are not bored, so they can kind of stay connected, will be to advocate for new televisions to be put in or for old ones to be repaired. And so the outcome we'll be looking for is for the elderly to not feel isolated and to not feel bored with their everyday lives, especially those who don't have frequent visitors. So that advocacy for that vulnerable population is really important there.